So let us briefly talk about the MHSD tab. So all the tabs are quite important. However, when you are about to face the data concerning MHSD, the question there is how many of your MHSD persons are in your TB MHSD register. So this question is directed to, in this case, this ComCare user. He's supposed to go to his book, count, and let's say he counted in his MHSD register. He has 73 entries. He goes there and types 73. Then, like I said, a reaction will come up. So this reaction is green. It's a green reaction for him. So as you can see, what it reads here is it appears you have nothing to upload for MHSD follow-up. All your persons with MHSD written in your MHSD register have been uploaded into ComCare for the period of review. So that sounds like good news. However, it doesn't stop there. You still need to go to your MHSD register to be able to see the status of your MHSD entry. There are important information there that you can learn and in a way a feedback from Enugu to you. So let's take this fictitious patient. We blocked out the name to give our patients some privacy. So now, but for you, they are your patients, so you will be able to see your name in your own ComCare. So for this patient, the first patient here is a 26-year-old female, and this ComCare user indicated in his phone that this person has a PHQ score of 6. And as we know, a PHQ score of 6 suggests or indicates is indicative of depression. However, this person was unable to commence MHSD treatment for this patient. So, according to ComCare or according to your entry in ComCare, this patient is yet to commence treatment for MHSD, signifying a gap. So this open date here is simply indicating the day you made that entry. I want to use this opportunity to advise all ComCare users to capture your entries, your observation as soon as possible, because that is the only way we can suggest the quarter in which that activity was carried out. Don't let 2 weeks pass before you make your entries into ComCare, because it is from this date that you enter it that we can use to decide that okay, this event is a quarter 3 event or a quarter 4 event. The duplicate status is just if it's blank, it means that you rightly only entered it once. However, even if you entered it twice, we will only take the latest one and discard the older one, but we will still indicate here that you entered it twice. You will see some entry here. So now, this column here for MHSD is only when you see this number 3, number of person identified with, it's just saying that that person has MHSD as indicative or as indicated from the PHQ 9 score that you, the ComCare, entered. And of course, we have also calculated for you that this person does not have substance use disorder. The calculation is made from that screening input you made while you were screening the person. So we have summarized it here and said that this person does not have any substance use disorder. And then we put a checkbox here to ask, should this have been indicated for MSSD referral by the ComCare user? And the answer is yes. Yes, because we have seen that the person has PHQ 9 of 6, has depression, so should have been clicked for referral. So this person did well here to have clicked it for referral. So let me quickly skip to this line 5. Mhm. So this line 5 here is saying is a 30-year-old female, and from the PHQ 9 score, this person has 3. 3 is suggestive that this person does not have depression. So rightly, this person cannot be commenced on treatment for um, MHSD. And then the date this entry was made was on the 23rd of August. That's when he started making entry for this person. And then the duplicate status, he rightly only entered that person once. That's good. So now we come here and we find out that he has no depression, or we have seen that he has no depression and no substance use disorder. So ideally, this person shouldn't have appeared in the MHSD register, but it appeared because this ComCare user clicked that he referred this name for MHSD treatment. That is why it appeared in this register. So when you see here under this place no, it's just saying that although you did well capturing it, because this entry neither has depression nor substance use, he shouldn't have, or she shouldn't have been referred for MHSD. That is just what this column is suggesting. So still on the MHSD register, there's still this column that asks, check, is this ComCare entry written in your MHSD register? So you still need to take it line by line to know the ones that are missing and the ones, even after checking for the quality of the entries. Now you take it line by line, and if a name is there, you just indicate yes. Remember, it has to be small letter. Just keep indicating, even though we have seen that he didn't need to upload. Just check, cross check. The devil is in the detail, like some of my senior colleagues would say. Check to see that these names are on your registers line by line. If you come across a name that's not your register, just put it no, so that you can take note of those names that are in or not in your register. So similarly, if you have a name that seems to be missing here, you can just take the time to keep track for yourself. These names appear not to be visible to the people in Enugu. Just keep track to see if to just keep track so that when you're done, you can mark them and upload them into ComCare. So just imagine now that these 3 names were not in this were not in the template. So you've taken this place here is just to help you to take note of those 3 names. So after you have written or typed them here, I've taken note. The next step is to go and upload them in ComCare. But before you go and upload them in ComCare, it would be good to check um, if you look at the top of this place, you will see the date when uh, this document was produced. It writes there 2024-0113. This means the 13th of January 2024. So that's 2024 is the year, 01 is the month, and 13 is the day. So, as at that day, this was what was in ComCare. So it is possible that between that day and when you are getting this Excel book, you may have already entered it into ComCare. So if you have evaluated and you see that these names are not in ComCare, it is mandatory for you then to go and upload them into ComCare. So you may also have noticed from an entry that, for instance, this line here has a PHQ-9 of 10, and you feel that you know that this person has commenced treatment, but here it is evident that we in Enugu are seeing it as not yet commenced MHSD treatment. The next thing to do is to go to ComCare and go and update the treatment status of this person. If that person, for some reason, has not yet commenced MHSD register, and you have concluded he cannot be commenced on MHSD treatment, then in ComCare go and indicate that this person has not yet been treated for MHSD.